Us2.ai does is we automate the analysis and interpretation of echocardiograms. Those are images and videos of the heart. So we take what's normally an error-prone half-an-hour process and turn it into something that's no clicks in 2 minutes, and you get a complete patient report. My name is James Hare. I'm CEO and co-founder of Us2.ai.
Us2.ai aims to automate the fight against heart disease by providing completely automated full analysis of the most commonly used tool to look at the heart, which is ultrasonography. And how that reaches every life is that with this intelligence, even people who've not done echo before can be enabled. So everyone can echo and everyone can have heart health in their own hands. I'm Dr. Carolyn Nam. I'm co-founder and non-executive director of Us2.ai. I strongly believe if ultrasound is such a safe modality and gives us so much information about heart health, it should be in the hands of everyone. And the way to do that is with artificial intelligence.
Cardiac imaging is always going to be integral to the patient pathway, about diagnosis, about treatment decisions, about prognostication. And AI is a tool to enable access in a democratic way to high-quality echo, high-quality decision-making, and hopefully better outcome for our patients. So that's where I think AI can have a role, helping to democratize who can actually do an echo, the interpretation and the standard of that, and ultimately the decision-making for our patients.
We actually help you take away all the things that are super manual, labor-intensive, and we take that part and automate it for you. So this saves you time, and that time you can actually use or spend with your patient, or do better acquisition or more acquisition.
It does the most basic things better than we are doing now, so as a clinician. And then what it does is it says, well, not only are you going to be as good as, you're going to be better than. So it's like looking 10 years in the future but doing it now, and doing that with a robustness that's built on science.
The gain that you get, the reduction of error in reducing variability of day-to-day measurements doesn't even speak to the other benefits of using a platform like this. And the efficiency gains in throughput in a lab are just incredibly amazing.
For the first time, we may show that healthcare providers, nurses, maybe general practitioners also, can make the diagnosis and can help titrate medications. And this will be a big game changer.
Actually, perception of how good it was until I got the software. And then I just analyzed a couple of echoes and I couldn't believe what actually the software was doing. Just one click, load the images, and all the measurements were there.
Which can then be automatically analyzed by our application, which leads to the end result being a report with findings. So the end aim for us is everyone can echo.
I think the best marketing that could be done for the software is actually giving people access to the software, because I think the software just speaks on its own.
So that's our mission, is to expand access and make ultrasound available to people like us too.